welcome to the latest edition of the Health and Safety Matters podcast. My name is Mark Sennett. I am the CEO of West Midlands Media, which is the publisher of Health and Safety Matters. Delighted that you could join us for today's podcast, which once again is sponsored by the Health and Safety event. And if you don't know by now, I don't know where you've been, but the Health and Safety event takes place at the NEC in Birmingham next year. It's completely free to attend. It takes place alongside the fire safety event, the security event, the workplace event on the 30th of April all the way through to the 2nd of May 2024. It's completely free to register to attend, and your ticket gets you access to all of the other events that are on there. So you can register your interest to attend for free now. All you need to do is go to the healthandsafetyevent.com, and HSM is proud to be the lead media partner of the Health and Safety event. So please do go over across to healthandsafetyevent.com and register your interest for the event. Now, as I always say, you don't have to wait till this podcast comes out to get the latest news in the health and safety sector. You can do so on our website, which is hsmsearch.com, or just throw into a search engine Health and Safety Matters, and up we come. And if you go to the Health and Safety Matters website, you can see all the latest news, prosecutions, products and services, and best practice in the sector. If you click on the webinars tab right at the top of the website, you can see our huge archive of CPD webinars where you can watch and download a CPD certificate with your name on it, or sign up for free to any of the upcoming webinars where you can do the same. You can also sign up to get our twice a week HSM e-newsletter along with 50,000 other professionals, or you can sign up to get copies of the magazine for free on there, or see our digital archive, and it also gives you access to our annual PPE Insights Guide, which has just gone to press, and also the annual BSIF Guide to UK Health and Safety that's up there. So plenty for you to look and see. You can follow us on Twitter or LinkedIn as well. But as always, we do start with the news, and I don't think I really have any choice but to go over the obvious big story, and that is the indefinite CE marking use extension announced. This has been somewhat controversial, probably, let's say, somewhat predictable and very frustrating for manufacturers in the sector. So the Department for Business and Trade, DBT, has announced its intention for an indefinitely extend the use of CE marking for businesses applying to 18 regulations owned by DBT. This comes as part of a wider package of smart regulations designed to ease businesses' burdens and help to grow the economy by cutting barriers and red tape, so the government says. Following extensive engagement with industry, the British firms will be able to continue the use of CE marking alongside the UK CA marking. So the Business Secretary has acted urgently on the issue, they say, to prevent a cliff edge moment in December 2024 when UK CA marking was set for entry. This intervention will ensure businesses no longer face uncertainty over the regulation and can cut back on unnecessary costs, freeing them up to focus on innovation and growth. So the Business Minister, Kevin Hollenrake, said the government is tackling red tape, cutting burdens for business and creating certainty for firms. We've listened to the industry and we're taking better action to deliver. So by extending the CE marking across the UK, firms can now focus their time and money on creating jobs and growing the economy. This has been backed up by Tina McKenzie, who's the policy chair of the Federation of Small Businesses, and she says it's welcome to see the continued recognition of CA marked products. This will allow time for small firms to adjust to UK CA marking system and focus on growing their businesses both at home and overseas. There's also a comment in the article from the CEO of Make UK, Stephen Phipson, and that's the manufacturers organisation, and he says this is a pragmatic and common sense decision that manufacturers will very much welcome and support. I think at this point I probably really have to talk about comments from our partners, the British Safety Industry Federation, on this, and Alan Murray, the CEO there, has made a quite to the point statement on this. He says the announcement on the 1st of August by the Department of Business and Trade that CE marking will continue to be accepted when placing manufactured goods, including PPE, on the market in Great Britain indefinitely was in many ways not a surprise, given the number of times planned implementation dates had already been pushed back. The spin on this announcement was, as one would expect, around support for businesses reducing red tape, and the claim of support is hollow, in my opinion. It's something that should have been done 3 years ago, avoiding the excessive financial investments in UKCA compliance by BSIF members, and also very significant costs for approved bodies setting up and establishing themselves in the UK in order to be able to give product approval decisions under the now, at best, sidelined UKCA regime. I don't think I could put it any better than Alan than that, to be honest. It's incredibly frustrating. Huge, almost waste of time and money for manufacturers, and as we said there, approval bodies too. The government's backed itself into a corner. It's had to do this. The argument is, why didn't it do it all along? That's exactly what Alan's comment here is. It's a farce. It's the right decision now, obviously, at this point, but why it didn't happen from the start, heaven only knows. It wasn't well thought out, and I think Alan's been polite there. Marginalised or sidelined at best. The UKCA is probably the right way to put it. So the next news story I want to go on to is you can see it on our website. You can see all these news stories on our website. If you go into the website, hmsearch.com, we do have a search box for this. If you put the title Women's Workplace Health, this will turn up. And the title of it is New Report Highlights Hidden Crisis for Women's Workplace Health. So BOHS, which is the British Occupational Hygiene Society, which is a scientific charity and a charter society for workforce health protection, if you're not aware, has published a groundbreaking report titled Uncovering the UK's Hidden Crisis in Women's Workplace Health. And I think this is a really interesting report. So the report highlights the urgent need for measures to protect women from getting ill health at work. According to statistics by the HSC 2022 Labour Force Survey, it tables an estimated 918,000 women suffer from worsened health due to exposures at work, compared to 778,000 men. However, these figures are believed to be underreported, indicating an alarming gap in monitoring, measuring and reporting the true scale of problems. The report highlights that women are carrying more of a burden on occupational disease than men, and emphasises that immediate action is needed to address this crisis before it becomes unmanageable. So talking on this, BOHS President Alex Wilson said, "We are witnessing a silent and growing crisis that is significantly damaging women's health in the workplace. As scientists committed to the prevention of workplace and ill health, I'm delighted that our society and occupational hygienists are showing leadership in the neglected area. However, the burden of occupational disease on women is an issue that demands urgent attention from stakeholders across the occupational health spectrum." So this report aims to initiate a discussion on this crisis. It examines instances where the relationship between work and society fails to safeguard women's workplace health. The BOHS advocates for considering the impact of the workplace of women's health and measures the national equality policy, health and safety, impact and social sustainability. So adding to this, the Council for Work and Health, which brings together the bodies which represent the professionals delivering health, safety and wellbeing services to the working age population, commented, BOHS, a member of the council, has raised the important issue of women's health in the workplace and what may be a lack of awareness of the nature of the threats faced with women at work. So the key highlights of this report, I think is worth sharing with you guys, is there's an alarming rise in work-related illness among women. We've obviously covered that. The report gives evidence that women are falling ill due to their work, necessitating immediate action. There's an underreporting, as I mentioned earlier, of women's work-related illness. And there's a need for monitoring reporting is another key thing. And the report also reveals that women carry a heavy burden of occupational disease compared to men, of which is entirely preventable, the report says, presenting a significant opportunity for business, the economy and society to save costs and protect the health of their female workforce. So the BOHS is calling for everyone involved in occupational health protection to prioritise the impact of workplace on women's health. The society stresses the urgency of this collaboration efforts needs to happen now, and this issue must be pushed to ensure they're healthier and more equitable work environment for all women. So it's really interesting stats, this. What's worrying is the underreporting, for sure. But it's a staggering difference. 778,000 men compared to 918,000 women. And if we're saying that it's underreported, the gap could be even worse. So, yeah, I completely support the BOHS's stance on this of, trying to push us forward, because more does need to be done to protect all people in the workforce, but in this case, particularly women, to make it more in line with the numbers of men. Of course, everyone's aim in health and safety in OSH is to make sure that everyone in the workplace is safe and can return from work safe. And this is just another step, this important step of pushing this forward. In this country, we have a very good and pretty static workplace fatalities statistics, which we covered in the last podcast. But workplace health is an ongoing battle, whether it's mental health, physical health, and it is really important that all employers do everything they can do to protect their workforce. So another story I want to go on to now, and I cover this infrequently, we cover it all the time on the website. In fact, the most read things on our website are often prosecutions, because I know you as safety practitioners read these prosecutions and you can relate them back to your workforce, and that they are stark warnings when a major health and safety incident happens. This particular incident is very mainstream one. It's not one that so you can bring back into the workplace, but it's such a huge fine that I just wanted to share it with you. There was a £14 million fine for the Croydon trams crash failing. So Transport for London and Tram Operations Limited have been fined a total of 14 million at the Old Bailey in London following an investigation by the Office of Rail and Road. I'm sure you're very familiar with the Croydon tram crash, and this is obviously a massive fine. 7 people died and many were injured, 19 seriously, when a tram travelling in poor weather and at 3 times the speed limit overturned approaching the Sandilands Junction in Croydon on the 9th of November 2016. Of the 69 passengers on the tram, only 1 escaped injury. So this has obviously been major news, and like anything, does take a long time to go through the courts process. So each company pleaded guilty to offences alleging that they had failed to do everything that was reasonably practicable to ensure the safety of passengers on the tram network. Neither company had performed a suitable sufficient assessment of risks of high-speed derailment on the network. TfL, which owns and maintains the infrastructure used by the Croydon tram network, was fined a total of 10 million. And TOL, which operates the network, was fined 4 million. Since the accident, new safety measures and systems have been implemented, following recommendations from a rail accident investigation branch, which is the oversight of OOR. And these recommendations included new systems to prevent trams overspeeding around tight curves, improvements in managing driver attentiveness, more signage and chevrons at the Sandilands curve, and at other high-risk areas along the track. So the tramway sector has also instituted a new safety and standards body, the Light Rail Safety and Standards Board, which is LRSSB, the purpose of which includes improving the sector's understanding of risk and setting recognised industry standards. So commenting on this, the Chief Inspector of Railways, Ian Prosser, CBE, said, when faced with the evidence of their failure over a number of years, both TfL and TOL accepted that they had not done everything that was reasonably practical to ensure the safety of their passengers and the terrible consequences in the early morning of the 9th of November 2016. We must never forget this tragedy of that day and must strive to learn all of its lessons so there can be no repetition. Our thoughts remain with those of the lives who were affected. The judge's remarks and the sentences imposed underline to corporate defendants and the whole industry that the first responsibility is to ensure the safety of passengers and staff. We welcome the improvements made to the network since the incident, and we will continue to scrutinise this vital industry and hold operators to account if they fail short of these measures. I mean, it's just something I wanted to share. I cover every so often a major fine. Very rare do I ever get to talk about multi-million pound fines above 10 million. So it's a 10 million fine here and a 4 million. It's a true tragedy. I'm sure I said we all remember it, and I thought I would raise it now simply because there has been a lot done, learning lessons since, and obviously we hope that we'll never see another tragedy like this again. So the last couple of things I want to cover now really is to help you guys in terms of learning. So I'm delighted to say that registration has now opened up for our first ever in-person event for Health and Safety Matters, and that is Health and Safety Matters Live Scotland, which takes place at the Edinburgh International Conference Centre on the 16th of November 2023, that's this year. It's completely free to attend. We're very grateful to MSA for being a headline sponsor. It's also co-located with the BOHS Sustainability Conference, but you can register to come to HSM Live Scotland completely for free. You just have to go to hsmlive.co.uk and you can go on there and register right now for free. We've already had 250 of you register in the first week, so thank you to all of you. We're very much looking forward to seeing you up there. The thing about this event is, yes, you've got access to free lunch, free networking, etc., all around an exhibition of 40 of the latest products and services in the health and safety sector. But we have got 2 theatres running with 10 sessions in each of CPD accredited content delivered by industry leading experts. It's your chance to ask questions direct to these people and learn from them and get CPD on it. And we've got speakers from the Health and Safety Executive, we've got speakers from the British Safety Industry Federation, and another one I want to pull out. I'm not going to go through the entire list. You can obviously see that on the website hsmlive.co.uk. There is a Scottish Health and Safety legislation update, but we've also got a health and safety mock trial being delivered by DAC Beechcroft. It is actually on a real case that happened in Scotland based on Scottish case law, where you guys will be the judge and jury on this one. You will decide as a jury whether the defendant is guilty. It's a complete remake of the trial, and I strongly suggest you come. This is the first time that we've been to Scotland in a long time, and it is the only major health and safety event in Scotland. Please do come along, or consider coming along, or encourage your colleagues to come along. It's completely free. Get a great free lunch there, great networking, great education, CPD certificate, you name it. 16th of November at Edinburgh International Convention Centre, and you can go to hsmlive.co.uk to sign up for that now. Now, if you can't travel to Scotland, there is another great educational opportunity for you, and that is the annual Health and Safety Matters Digital Conference is coming back, and we very much hope that you can join us for that. Again, completely free for you to attend. It takes place on the 4th of October 2023. If you can't go live, don't worry, you can watch it on demand for a year for free afterwards. As I said, completely free. Headline sponsors Eco Online. Our other sponsors are Safety Share and Intellects, and those three organisations are actually, if you register for this, they're actually giving exclusive downloads, educational downloads of videos that you can watch over in the sponsors hall once you've logged in. On the day, you can live chat with other delegates, as always on there, ask live questions to our presenters, and we have a great lineup of content for this. As I said, you can watch any of these sessions on demand afterwards for free, back and forth. You get a CPD certificate for each session that you go to with your name on. And so we've got Charles Oakley from the Health and Safety Executive talking. We have got also Dave Picton from Eco Online talking on carbon reduction and climate action. We have got 10 incremental ideas to take your safety culture to the next level from Ben Henderson at Intellects. We've got Evacuation Shares, Friend or Foe by Mark Roberts from Emergency Group, which is Safety Share. We have also got a great session on building a more inclusive workplace, recognising menstruation and menopause, being delivered by BSI, and also from Lauren Sheeran of Women of a Certain Stage. This follows on nicely from the news story we were just talking about women's health. We've got the British Safety Industry Federation. Roy Wilders will be talking about taking the risk out of specifying PPE, and that will be a key topic what we're about to talk about with our guest for this episode of the podcast. And we also have Louise Hoskins, the former president of IOSH, the recent former president, talking about empowering organisational sustainability, integrating social and ethical considerations for balanced decision-making across the globe. So this whole day, it wraps up at 2:05 in the afternoon. I mean, you can come in at any time in there, but the whole day starts at 5 to 10 in the morning on the 4th of October 2023. So please do come and to this event. You can see it listed on our website, and you'll see everything on social media. If you go to LinkedIn, Twitter, we're promoting it very heavily, so you can sign up for free. Definitely worth you going. So I mentioned in there that we're talking about RSSS and respiratory protection. That takes me on to our first guest on this edition of the podcast, and I'm delighted to be joined on this episode by a good friend of ours, and that is George Elliott of 3M. And this particular in-depth sit-down with George really covers a number of topics about respiratory protection, particularly how things have changed since the pandemic. So I sat down with George earlier today, and here's what he had to say. Morning, George. How are you?
Hello, Mark. Yes, very well, thank you. How are you?
Yeah, good. Good to see you. I mean, we've done a lot together over the years, from multiple webinars that HSM and 3M have done together, your own heavy machinery events, which I've helped chair up in Manchester and Bracknell. So it's always good to see you, George. And I would imagine you're rather busy at the moment.
Yeah, indeed. Yeah, it's just thinking back to all the events that we've done, Mark, and all the kind of webinars and, as you mentioned, events that we've done. So yeah, a lot in the pipeline that we've got arranged for later this year, be it webinars, be it events, and also planning for next year, which is pretty scary, really.
Well, and also it's worth saying we actually have a webinar. If anyone is with 3M, if anyone is listening to this after the fact, don't worry, you can watch our webinars on demand with 3M. There's a huge list on the HSM website. So just go to HSM search 3m.com. Click on the webinars tab at the top and you can see all past 3M webinars with us that George has sat on plenty. I mean, we have one that's taking place on the 6th of September, which is we're recording this, George and I, that is tomorrow. And that's all about work at height safely in heavy manufacturing. So again, you can go onto our website. That will be Stephen Morris from 3M hosting that one. So do go onto our webinars website. If you're watching this after 6, don't worry, it's completely free. You get a CPD certificate with your name on it. Go to hmsearch.com, click on the webinars tab, and do go through all the past 3M webinars. They are well worth a listen. Well, George, as I'm not doing a webinar with you personally tomorrow, this is my opportunity to grill you on a few things. So as usual, I'm going to fire away.
Yeah.
So I want to talk about the pandemic
absolutely.
for a minute, if that's okay. How has the pandemic affected the respiratory industry in the UK, in your opinion?
Yeah, it's quite a broad topic, really. And maybe if I just focus on disposable respirators, certainly during the COVID pandemic and since, there's been a heightened discussion of respirators, but also masks, face coverings, surgical masks, etc. And if you look back during the pandemic, you wouldn't go a day without turning on the news and probably seeing one of those products being worn. So I think there's certainly that kind of heightened discussion and awareness. But I think, unfortunately, and as I maybe yourself have experienced, sometimes we've seen that kind of misunderstanding of what these items are, what they do, who they're providing protection for. Because when you do dig deeper, there are differences in these products, and also we found when it comes to respiratory protection, we've certainly seen a kind of variance in quality of products which came into the market during the pandemic and thereafter. And I also think that there's been that confusion with regards to the standards which disposable respirators, for an example, should be approved to, and products carrying the correct markings. And certainly during the pandemic, we saw K and K&N rated and approved products come into the market, and products without CE markings as well that maybe weren't approved to European and EN standards. So I think that sort of muddied the water a little bit. But I think me talking to you today and other learnings that we've had from the pandemic, I think we're certainly trying to promote best practice when it comes to selecting respiratory products. And I've only got to look at a recent HSE research report which was published earlier this year, research report RR1194, and that looked at ear loop products which certainly came into the market during the pandemic, and the research report was critical, certainly regarding the pass rates of face fit testing with these devices, and by all means, those that are listening do look at the research report in more depth, but certainly the kind of headline number from it was that from 99 face fit tests that were conducted with these ear loop respirators, only 2 had an effective fit factor, which in the UK is over 100. So the main observation of those types of products was that these ear loop straps fail to provide that adequate tension to secure the product onto the face, and this lack of tension and maybe ill-fitting of a nose clip resulted in visibly large gaps around the face seal. So that's just another example of products which were coming into the market which previously weren't being utilised in the UK as much. So again, while I think the pandemic has increased awareness of the need for respiratory protection, I think rather than simplifying things with these ear loop products coming into the market, non-EN rated products coming into the market over the last 3 or 4 years, that it certainly has created some confusion, and we've experienced that with our customers. So I think in summary, Mark, because it's quite a broad question, for those that are maybe confused or looking for some guidance when it comes to selecting respiratory protective equipment, making sure that when they are procuring these products, that first and foremost, the products are CE or UKCA approved, although, of course, there's been recent changes with regards to UKCA markings. Also, you've carried out due diligence on the quality of these products. And also, and this is a topic in itself, check the products in question are actually genuine and are not counterfeited as well. And that's certainly where you can work with your PPE manufacturer and supplier of PPE as well.
Yes, I don't think we're going to go over the CE and UKCA marking conversation at the moment, because I'm pretty sure everyone has strong views on that, and certainly the BSIF do. But I want to talk about what you mentioned about counterfeit products. And we're talking about the BSIF there. Obviously, we as HSM support the BSIF's Registered Safety Supplier Scheme, and I know that's something that 3M are very supportive of as well. But when you mentioned counterfeit products, what did 3M do during the pandemic to counter this?
Yeah. So I said I didn't necessarily cover it in the first question, but I suppose this gives a bit of an opportunity to expand. So yeah, certainly from our experience, we experienced and encountered a variety of counterfeit and fraudulent activities, not only in the UK that I personally observed, but also activities globally. And during the pandemic and still up to this day, we've got a reporting mechanism on our website where customers can raise concerns over potentially suspicious products which they've seen in the market, maybe products that have been offered to them. And that's not just respiratory protection, that's all forms of PPE. But just to provide some perspective, I just got some kind of numbers, and this is as correct from today. So since we established that reporting mechanism, we've had globally over 18,000 reports of potential fraud or counterfeiting, which have come into our system, which is pretty incredible, really, given we're only talking 3.5 years. Of those, we've actually taken, we've got 41 lawsuits which have been filed to date on those reported incidents. A really large number is the fact that nearly 60 million counterfeit respirators have been seized, and we've helped support that with local authorities. 60 million is a huge number there that we've managed to have seized and not enter the market. But we've also been able to work online with organisations across the globe to remove false or deceptive social media posts, fraudulent e-commerce offerings that products that have been proposed which don't actually exist. So it's quite a significant amount of work that we've been doing over the last 3.5 years. And it's very poignant you mentioned, Mark, the BSIF Registered Safety Supply Scheme, because that is certainly something that we would suggest end users look for when they're looking at PPE suppliers. It's very advisable to work with the PPE manufacturer of choice or your supplier of choice to ensure that products are genuine. And as you mentioned, we are members of the British Safety Industry Federation's Safe Supply Scheme. And this scheme, is where PPE manufacturers and suppliers are audited by the BSIF to ensure that they're abiding by the strict compliance with the ins and outs of manufacturing and selling PPE, given the environments that these products are being worn. So certainly a kind of mark of authority is to look out for that safety supply scheme. And then when it comes to 3M products, respirators should be sold in 3M packaging, which should include user instructions as well. Again, we've got our authorised distributors that we work directly with, and we can certainly direct you towards those. And again, just a reinforcement of the point of looking out for the BSIF Registered Safety Supplier Scheme. And also, 3M products are subject to stringent quality control measures. So if it looks wrong, it may well be. And again, that's where the end customers can reach out to us, either directly or through our reporting mechanism on the website.
And how can employers ensure that respiratory protection selected is compatible with other forms of PPA and fit together to ensure workers are protected? So, how can that happen? What's the best way for employers to ensure that?
Yeah. So compatibility is a key factor when it comes to combining a respirator in this example with other items of PPE or maybe prescription spectacles. And that's what I talk around products being suitable for the application. You got to make sure products are adequate and suitable. Adequacy is what I call the Ron Seal test. Is it doing what it says on the tin? You may need a respirator providing an assigned protection factor of 20, for protection against whatever you're trying to protect yourself from. And across the range of our respirators, we may have a dozen or so products which can provide that protection, but which is going to be most suitable for the end user, and with that in mind, which is going to be compatible with other items of PPE. So it might be that when they're wearing their respirator, they need to wear eye protection, hearing protection, head protection, bump caps, visors, etc. And when you're wearing a tight-fitting respirator, a disposable respirator, a reusable respirator, we need to ensure that there's a seal between the respirator and the wearer's face. So any other items of PPE which are worn on the face or head may compromise that fit, may affect that seal of the respirator to the face. And I always look at what the health and safety executives say when it comes to compatibility and any other topics. And when you look at their fit testing guidance information, INDG 479, it does outline that when people go through their face fit test with a tight fitting respirator, they should be doing that when wearing the other items of head-worn PPE to ensure that they're not negatively influencing the fit of the respirator and therefore affecting compatibility. So I think it's written there in black and white that compatibility certainly needs to be considered. And, certainly working with your manufacturer of choice. They may have eye protection, which has been designed to be worn with certain respirators. But also, there's opportunities where combining items of PPE into one solution might be beneficial. So maybe rather than wearing a reusable respirator with eyewear and a hard hat or bump cap, it might be that you can integrate that with a loose-fitting head top, which includes a helmet, a visor, connected up to a powered air respiratory system. So, compatibility certainly needs to be considered on that individual basis, depending on what that individual is also wearing and what the needs are within their working environment.
So, George, a question that we always get on the RPE webinars is about facial hair. And, as two men with designer stubble, this is obviously an important question to us. So when we've done the webinars, the question of facial hair and respiratory protection has always come up. What can customers do for those with facial hair?
Yeah, as you say, Mark, it's something that I think you and I always predict is going to come up when we do seminars and webinars. And I will say, Mark, I think you can speak for yourself on the designer stubble. I'm more just lazy as opposed to having it for any other reason. But yeah, certainly for you and I, tight-fitting respirators, disposable respirators, reusable respirators, anything that is forming that seal between the respirator and our face should not be worn by those that have got facial hair. They rely on that tight seal between the respirator and the wearer's face. Therefore, wearers should be clean-shaven when wearing the product within the workplace, but also for their face fit test as well. And sometimes that message is maybe difficult to convey, and maybe this isn't the best means of communication because we're obviously having a discussion, and I can't necessarily show the audience, but hopefully what I can explain is relatively easy to imagine, and the way that I try to explain it is talking around the width and size of a human hair, a hair cell, something that you can see with the naked eye. That's anywhere between 100 to 125 microns in terms of its width. And as I say, it's visible to the naked eye. But when we're talking about the hazards that we're trying to protect ourselves from in the working environment, be them particulates, be them gas and vapor molecules, a vast majority of these are invisible to the naked eye. We just can't see them because they are so small. And when you compare the width of human hair, as I say, 100 to 125 microns against molecules and potential very small particulates that we're trying to protect ourselves, which may be single microns down to fractions of micron. Hopefully people can visualize that when you look at the hair on your face, for example, there are gaps between that hair and certainly, these molecules and these particles can go between these gaps within the facial hair and bypass that seal. So that's why it's important to be clean shaven where that respirator seals to the face, because you just can't afford to have those gaps where your facial hair is. And also those with larger beards would potentially force the respirator away from the face as well. So that sheer thickness of individual facial hairs can hold the respirator away from the face, but also create those leak paths for those micron-sized particles, gases and vapors to leak through. And I think that's only reinforced within the HSE's viewpoint, and they had another research report. I mentioned one a little bit earlier, but there's a research report from a few years ago, RR 1052, which just reinforced the message that facial hair can significantly reduce the expected level of protection for the wearer. So individuals need to be clean shaven where that respirator seals the face. So yeah, the HSE are pretty clear for those with facial hair. If an employee requires respiratory protection in the workplace and they've got facial hair, then there are non-tight fitting devices available. Typically this is going to be in the form of a loose fitting head top connected to a powered or supplied air device, providing either filtered air in a powered air device or breathable quality air to that head top. And because these devices aren't relying on a tight seal to the face, and typically they've got an elasticated seal which comes into contact with the chin or neck, or even a shroud which enters the individual's clothing or coverall, for example, that they're not relying on that seal, and therefore individuals do not need to be clean shaven where they would be if a tight fitting respirator was being worn. So I guess in conclusion, Mark, there's devices which are available for those in similar situations to you and I. And if respiratory protection is needed for example, you and I in the workplace, there are these loose fitting devices which should be considered.
So we've covered a lot today, George, but as a takeaway, what would you advise those listening to the podcast to consider when assessing their current range of RPE and any potential future procurement?
Yeah, I think I've expanded quite a lot on the previous answers, but I'll try and keep it simple as a bit of a conclusion. And we often at 3M talk about a simple 3-step procedure, which we describe as choose wisely. So I guess the first step is to check it. So as discussed earlier, make sure that the products are appropriately approved, marked, they're of sufficient quality, they're genuine products, and they have come from an approved supplier of the manufacturer, and as we discussed earlier, that supply being part of the BSIF Registered Safety Supply Scheme. The second one is to fit it, and what I mean by this is both face fit testing if it's required, but as we discussed earlier, making sure that the respiratory protection also is fitting the individual, they're comfortable, it's compatible with other head-worn PPE. So ensuring that fit is adequately considered. And then the third piece is, really, you want these devices to be worn and worn at all times that they're required. So we want to ensure that there is good compliance when wearing these types of devices amongst the workforce. And often we've found that it's beneficial to involve the workforce in the selection process, possibly with trials, so that the workforce, have been able to feedback on certain products that are being considered. And they've actually been involved in that decision-making process. So hopefully with that, there's that buy-in from end users, because they've been involved and been a part of the selection of the most optimum respiratory solutions for themselves. So yeah, check it, fit it, and then wear it, and hopefully we can boost that compliance.
And George, we always finish the same way when we have guests on the podcast. You get a lot of key information today. If people want to find out more about 3M products or want to get in touch with you or anyone in 3M, what is the easiest way to do so?
I suppose it depends on the information that you require. We've of course got our website. If you use your search engine and search for 3M Personal Safety Division, you'll find our website there, and obviously take yourself to the UK and Ireland portion. We've got some self-service information there. We've got a respiratory protection selection tool. We've of course got our data sheets of products available there, and lots of other information, white papers and webinars, as well as webinars we do with yourself and HSM, Mark. We have our own webinar series as well. We've also got lots of information on face fit testing on the website as well. So that's kind of self-service. But we also do have a helpline. So people could actually fill in a helpline form on the website, and we'll get back to you following that. But we also have a telephone number. So for UK callers, it's 0870 6080060, and for those in Ireland, it's 1800-320-500. So again, if you want to have a more in-depth discussion about your respiratory needs or even any other items of PPE, then you of course can. And then we've got LinkedIn, which is a great platform where myself and colleagues do post a lot of content, when it comes to respiratory protection, face fit testing, other items of PPE. So another good platform to connect in, because we like to think that we post some very educational content.
Well, George, as always, it's great to see you, my friend, and thank you for such a great overview of everything RPE.
No, thanks, Mark. A pleasure, and once again a great opportunity to connect in with you and share some. Hopefully, people will consider some good practice.
And that's all we've got time for in this edition of the Health and Safety Matters podcast. My huge thanks to George Elliott from 3M. And as I said, you don't need to wait for this podcast to see all the latest news, prosecutions, products and services in the health and safety sector. Go to our website, hsmsearch.com, or you can throw into a search engine Health and Safety Matters, and up we come. If you go to the website, you can click on the webinars tab and watch back on demand for free any of our past webinars. You can also sign up to come up to any of our upcoming webinars. And obviously, we just talked about a 3M one, and we talked about earlier about the HSM Digital Conference, which is up there too. You can also sign up to get copies of HSM, the PP Insights Guide, and the annual BSIF Guide for free, or just look at them online in our free online archive, or you can sign up to get our e-newsletter twice a week. You can also follow us on LinkedIn and social media. If you've got any comments and feedback on the podcast, please use the hashtag HSM Podcast. We'd really appreciate it if you leave feedback, however you listen to podcasts, or whatever application or YouTube you're watching on it now. Please leave your comments and ideally give us a good star rating on there. It would be much appreciated. And I'd also like to finish by thanking our usual sponsor for the podcast, which is the Health and Safety event. And as we said, it's completely free for you to go to the Health and Safety event. It takes place next year, 2024, back at the NEC in Birmingham on the 30th of April to the 2nd of May, co-located to the fire safety event, the security event, and the workplace event. One pass gets you access free to all of that, and Health and Safety Matters are proud to be the lead media partner for the Health and Safety event. And if you go to the website now, healthandsafetyevent.com, you can register your interest for a free ticket. But thank you for joining us. In the meantime, please do go to our website and follow us on social media. But until then, thanks for listening, and we will see you next time on the Health and Safety Matters podcast.